Mixed delivery allows us to combine federal funding with state funding and local funding. And when we all use these pots of money together, we are smarter about the way that we use our resources. And as a result, we're able to serve more children in settings that best meet the needs of families.
Mixed delivery is important because there are so many 4-year-olds that do not have access to preschool, and we know that kindergarten readiness is extremely important.
So mixed delivery really is a back piece that nobody really sees or understands other than the director of the site. It is really a lot about the mixed funding streams that help pay for the children to have access and the added quality components to the sites that are participating in mixed delivery. The bottom line is all children receive the same high quality care and opportunity regardless of their socioeconomic status.
I think our biggest need was teacher education, and just for teachers to learn more on how to educate their children and how to have them ready for kindergarten. There are other ways and other methods that teachers can use, and we just didn't have all those resources. So now with mixed delivery, we are able to put that in place for our program with our pre-K teachers, and it just flourishes them throughout the school year.
It made me a better teacher. Believe it or not, when they first introduced it, I was excited, and then, like I stated also earlier, when I began to implement the curriculum to this mixed delivery program, I was overwhelmed. But as I done it, I saw how the children grew, how they were able to follow directions. It helped them learn things that I know in a regular program without the mixed delivery, it would be hard.
One benefit would be materials. Materials are always, we can order every year and replenish every year, but we're about halfway through the year, they're gone. So materials has been a very big benefit for us, just the things that they've been able to receive. They've received a lot of fine motor activities. They've received a lot of literacy themed items where we can put literacy in each area in our classroom, where at one time we only had literacy in our library or near our word wall. Now we have literacy throughout our entire classroom.
The parents are seeing their children go from maybe not being verbal to suddenly being able to know their colors and writing and reading. We're seeing such a growth in literacy development and social and emotional benefits.
Children got a chance to experience things that they normally would not be able to experience. Exploring outside, an example, going camping. You'd be surprised how many of the children in my community, they know nothing about camping. What I did was have a camping theme, and we camped outside, and the whole class was able to participate in that. We went fishing, we made binoculars so that they could sightsee, go bird watching. We pretended to go hiking, just giving those children that have never experienced that, giving them that experience.
Over the last, I would say, 5 years, United Way has been involved in these conversations statewide to figure out how do we make quality care more accessible for young children? Because we know that the demand is always greater than the capacity out of our local communities, and even our public school systems and Head Starts are currently publicly funded programs. And so that's always been a question in the mind of Virginia legislators to say, how do we make the most out of the resources that we have in the state? And how do we make sure that that benefits the most vulnerable families in our community?
This is not just between a center and the work that we're leading. We are pulling together so many different people, community partners through this process so that additional resources can be tapped into for these centers. We have had Roanoke Valley Speech and Hearing come in and participate with some of the participating sites, and they offer free hearing screenings. And so then also speech services have been provided for children of mixed delivery at no charge or at a very low cost, and they come to the center and they provide these services at the center site so that parents don't have to worry about making an appointment and working around their own work schedule to get their child to additional services that are necessary. So it's been really rewarding to be able to find other resources that can come in to provide services for the sites and families.